All right, so no license, but the doors are open and the legal fight continues. So let's discuss with Fox News contributor Jamu Green and the director of strategic communications at Live Action, Alison Centofante. Great to have both of you with us tonight.
Thanks for having us, Shannon.
Hi, Shannon.
Okay, so the AP headline is Missouri rejects license renewal for lone abortion clinic. Among the problems health department investigators have cited were 3 failed abortions requiring additional surgeries and another that led to life-threatening complications for the mother. Jamu, aside from abortion, whether you're pro-choice, pro-life, wherever you are on this thing, I mean, what does this say about the fact that this is, these are health standards that you would want anybody, a patient, regardless of what treatment they're seeking, to be safe, to be protected, and apparently this clinic will not cooperate with the investigations?
Well, Shannon, I'm definitely pro-woman, and that, unfortunately, is what these anti-health politicians are not. I hear you on these fabricated regulations that these anti-health politicians have created to shut down abortion services in Missouri. This is strategic. It is a decades-long plan. This is something that I know that Alison's organization has been very focused on.
Aside from
these
that,
are not about these regulations. This is about shutting down abortion.
If they're documenting cases, and I've read the documents, just straightforward documents talking about women thinking they've had a successful abortion, they leave, they come back weeks later finding out they're still pregnant, and all kinds of things that are very odd to happen there, and they're looking for answers, and the staff will not do interviews. They won't make themselves available. They had some, number of women who have gone by emergency to the hospital. So if you're pro-women, I would think that you'd want all of them to be safe.
I want this service to stop being the most inappropriately regulated health service in the country. And this is a decision between a woman, her family, her doctor, her God. But politicians like the governor in Missouri have wanted to shut down abortions, and whether how large your door size is or pelvic exams, if you're going to have a
let's bring Alison
medically
in here.
induced abortion, these regulations are intended to shut down abortion, and that is against women's health.
Alison, what about that point? Because Planned Parenthood says that the governor there, in their statement, and that the Health and Human Services there, they're weaponizing the regulatory process to try to deny an abortion facility a license to be the last remaining health center in Missouri that provides abortion. And you've heard Jamu's arguments, and she's not alone in people saying it's really just about shutting down access to legal abortion, and that's what this is all about.
Let's talk about what this report says. Planned Parenthood says our doors stay open no matter what. Well, now we know what that what is. This Planned Parenthood in St. Louis failed 24 out of 30 health and safety standards. One of those was failing to follow state laws. These aren't just regulations, these are laws that they are put in place to keep women safe. Things like expired medications were being used on women here, old tools. They were using single-dose injectable medicines on multiple people, multiple patients. This St. Louis Planned Parenthood, as your lead-in said, has sent women who thought they got abortions back, still pregnant. They had to return for a second abortion, and they were sent to the hospital with sepsis and life-threatening complications. The document is 60 pages long of the problems at this location. They should absolutely not receive the license. This is not political. The health department has made clear we cannot give this license in good conscience to this facility. And Planned Parenthood, who says that they care for women, who says that they put safety first, will not even cooperate. They've only addressed 4 of those things, 4 of those 30 discrepancies. So absolutely we applaud Missouri for doing the right thing. And if Planned Parenthood wanted to take care of women, they shouldn't be not cooperating with this investigation. They're hurting women at this facility. It's like Gosnell 2.0, and we're applauding Missouri for doing the right thing. Women should be terrified to walk into Planned Parenthood. It's a taxpayer-funded travesty. It's a taxpayer-funded trap for women when they put abortion and money over safety every time.
Okay, both sides have had their say here. We know there's a lot of heat and light in this topic, and it's now going to continue with the courts because it's far from over in this Missouri case. We'll track it and have you come back to talk about it. Jamu and Alison, thank you both very much.
Thanks, Shannon.
Thanks, Shannon.